Thank you, and thanks everybody for coming out tonight. Another beautiful day here in Sarnia with the sun shining, and we're really getting blessed with all this nice fall weather. So hopefully you're enjoying it all. And I guess I don't need to stand right here because I'm mic'd up. So I'll move around a little bit. But again, thank you. And tonight really it's about active aging, but it's also about my year's experience working in medicine and seeing a number of things work for people, or even things that I've tried myself, some of these different topics tonight. So it's kind of a mix of active aging, but also really an honest reflection of what I've seen over the years and what I think could be helpful for you. But this really kind of sums up the idea for tonight. And it kind of reminded me of like an Oprah, like the Christmas special where she used to give everything away, right? Yes. So you're all getting a trip to Florida. No trips, no gift bags, but the idea is like, you get one, you get one, you get one. So you're getting all health tips tonight. And the idea is there's going to be a number of them given out. And don't get overwhelmed because there's going to be 8, 9 different topics. The idea is to really kind of turn you on to some of these things and learn about it. And if you even adopt one new habit, then job done for me tonight. So I'm going to kind of lay it out for you to play it out, if you will. And even starting with a new habit, one of the things too, before we dive into some of this, take it slow. Right? Like just tiny steps, because I'm going to talk about meditation, and if you try to meditate for an hour tomorrow, you're probably going to stop and get very frustrated, right? So the idea with any of this too is to start really slow, really low, and gradually build up. Same thing for exercise, same thing for sauna therapy, dip the toe in the water, so to speak, and then progress into making it a habit. So kind of the genesis for this talk did stem from some of my clinical work over the years and teaching physicians about cannabinoid medicine and some of these holistic things. I often pull them to start the talks I'm giving to them about what they're seeing in their practice. And I kind of call this the new primary care, if you will. Chronic pain, sleep disorders, and mental health. So whether that's anxiety or depression, but that 3, and some refer it to as kind of the chronic pain triad or the unhappy triad, but I kind of coined it the new primary care. And all the docs, the hands go up that they see this. Some, it's 60% of their practice, some it's 70%, and certainly with the folks I see locally, including the senior population, this is a big part of the practice. So just curious, show of hands, who's trouble sleeping, pain, or kind of mental health? Someone you know or yourself? Yeah? Yeah, okay, there's the hands. Yeah. So it's common, right? We're all dealing with some of these things in some way, shape, or form. So that's why these topics tonight are going to be shown to you, because a lot of them can help with this triad. So again, you don't have to throw everything that I mentioned tonight into your routine, but think of one that might tickle your fancy. Okay. So to start off, this one is the easiest, if you will, because we all breathe. So it's cheap, it's free, you can control your breath to manage certain symptoms. When I think of breath work, the thing that really is apparent is for things like anxiety. I'm going to talk a little bit about that. In this list here, there's some evidence for breath work in improving pain, because you release endorphins, or your natural opioids, if you will, endogenous opioids. Breath work can do that and improve pain. You activate the parasympathetic nervous system, so not sympathetic where you're fight or flight and you're all revved up, but you're kind of rest and digest. So parasympathetic activation, release of endorphins can help with pain, but also breath work is a great way to connect your mind and your body. And that is the clear link, and tuning into your breath can connect those. It reduce anxiety. When you breathe in, diaphragm goes down, and then with that, there's more space in your chest cavity, which sends a signal to your brain to speed up your heart rate. When you breathe out, diaphragm moves up. Now there's less space in your chest cavity, and that sends a signal to your brain via the phrenic nerve to slow down your heart rate. So by breathing out longer, you can slow your heart rate down. So for a little exercise, if you take a breath in for 3 seconds, so 1, 2, 3, hold, 1, 2, 3, 4, and release 4 to 5, 4, 3, 2, 1. Let's try it again. It's a 5-second exhale, but 3 seconds in and a hold for 4. So breathe in for 3. Hold for 4. And out for 5. So you can feel that pretty quickly, that it's calming and it's real. There's real physiological changes by manipulating your breath. The same can be said if you want to get amped up, if you want to get fired up, and some people like to do that before activities, exercise. The exact same idea, you can forcefully exhale and start to build some heat, increase your heart rate. So you can use the breath to kind of wind up or wind down, but generally speaking, for relief of anxiety, acute anxiety, that 3-4-5 breath, there's various techniques, but a prolonged exhale is key. Kind of looks like me when I had a beard, which I shaved today, so just for you guys. Hey, so we had kind of a nice relaxing, bit with the breath work, but now picture you're leaving here, you're going down to Baxter Beach, and you're getting in that cold water, and you dip your toes in, and ooh, and right there can show you how even your thoughts can influence your physiology. Because just mentioning that cold, I'm kind of getting a little... But I wanted to do this part next because mention, things in literature or things with patients or things that I've done personally. And this is high on the list for new habits of mine that has been remarkable for a number of reasons. So if you can get over this idea that you're not going to like it, and just have a quick listen to some of these benefits, maybe I can change your mind to dip your toe in the water. But where it starts is certainly when you go into the cold water, and caveat too, you'd want to make sure your heart's capable, meaning no unstable angina or unstable cardiac conditions. Of course, speak with your doc, but let's assume you can. Number one, from a pain point of view, it's clear that this cold water therapy reduces inflammation. So, right there, reduce inflammation, improve pain, benefits of cold therapy. The next benefit, in addition to pain, which is a big one for most people, if we think about that triad, is it's like a workout for your cardiovascular system, because you go in there, your blood vessels constrict, your heart rate goes up a little bit. It's really shown to improve your cardiovascular system as well as your immune system. Perhaps the biggest benefit, though, is how you feel. Not just less pain, but to me, this is it. This is why I do it almost every day. It's like a cheat code, but you feel wonderful if you are in there for 3 or 5 minutes and come out. The body's response is to release norepinephrine, noradrenaline, dopamine, basically some of these feel-good molecules, and they stay high. They stay high for hours after. It's not up, down. So that dopamine arc is up for like 4 or 5 hours. So I love it because it's so obvious based on how you feel. The other benefit is the simple act, maybe it's not so simple, but this internal struggle, this internal dialogue, because I have it daily still when I walk to the beach and ask myself, am I really doing this again? But there's a moment there, or a few minutes of all the reasons why you shouldn't do it, or bed's warm, it's warm inside, and the ability to kind of dampen that voice and practice kind of dampening that voice, because you know this is good for you, is a mental workout in and of itself. And just kind of conquering that voice in that setting is a big win, because it leads to conquering that voice in everything else. So like that same voice that says don't go to the gym, the same voice that says go pick up the fast food and don't make the health. It's all the same voice. So beating it on a daily basis is another great win. And it's so effective that I've seen even in certain patients with refractory depression, they are so stuck in a thought pattern that they can't get out of. They don't even know what feeling good feels like anymore. So we use this to show them what awesome feels like. Because even feeling that way for short-lived, when you haven't felt that for years, can really spark something. So a few reasons why I'm a big fan of cold water therapy. Okay. This needs a bit more research, but I want to put it out there because active aging and a lot of this talk is also, there's kind of a theme of reducing dementia risk. And certainly, it's a hypothesis, but it does make sense. If you're improving your cardiovascular system, probably going to be helpful in reducing your dementia risk. We know that. The other thing with cold therapy, you get an increase in BDNF, or brain-derived neurotrophic factor. And this BDNF is very important for your neurons, for their growth, for new connections. And the thing is, it's like Miracle-Gro, essentially, for your brain, if you want to think of it like that. It really is this kind of wonderful molecule to support neuronal growth and new synapse connections, neuroplasticity. So you can then take it a step further, and if that goes up with cold water therapy, then you could conceive it might be helpful for lowering your dementia risk. There's been some studies to suggest that. More work's needed, but basically, if you're improving cardiovascular system, if you're certainly eating right, things like that, that can also help lower dementia risk. Sleeping over 5.5 hours lowers dementia risk. So that's going to be weaved into this talk tonight, is how also these things can improve dementia risk. So we've cooled it down, and now we're going to heat it up. We're going to talk about sauna, okay? Who here has been using saunas consistently? Cool, right on. So that's a great thing. And for those that aren't, just have a listen to this, because this is another one that is just, to me, so obvious on the benefits. There's very few studies that have, for instance, the first point, reduced mortality. So people who sauna have a reduced mortality risk to about 40% if you do it 3 or 4 times a week. So right there, I heard that a few years ago. It just kind of stopped me in my tracks. Like you can live longer by just taking a sauna a couple times a week. And it's true. Like some of this data is great data. Of course, it's from Finland, where they love their saunas. But they've done great job studying this. And now this is becoming very much a thing here in North America. And I'll go into the protocol. But so reduce mortality risk. Just like the cold therapy, again, we have improved cardiovascular health. So people who sauna, that's it. Lower their cardiovascular risk, reduced hypertension or high blood pressure, lower risk of cardiac events. And then you get into some of these other things like improved endurance and exercise performance, improved muscle retention. We're going to talk about why exercise is so important for your bones and your muscles, but even sauna can prevent muscle loss with age. And then you have some other benefits when it comes to immune function, skin health, and of course mental health. So again, with mental health, a natural modality that's been studied is sauna. And it does show people who sauna have better mental health. So this is back to our kind of theme throughout the talk on lower dementia risk. Unlike the cold therapy, where it's more not as well established, a couple smaller studies, this is fairly clear that there's long-term studies that people who sauna, and generally for the most benefits, it's 3 or 4 times a week, have a lower risk of Alzheimer's disease, to the factor of like 66% lower compared to those who did only once a week. Because you're improving your cardiovascular system, we're learning more dementia really is an inflammatory issue as well. So by improving cardiovascular system and something here called these heat shock proteins. So this is the other thing that is being studied and is now well documented for the benefits of sauna, possibly clearing out. These heat shock proteins basically kind of help clear out, like you mentioned, the toxins, some of the waste, some of these cells. So between improving the cardiovascular system, heat shock proteins, and then of course we're learning with dementia too, because it's more of an inflammatory diagnosis, what you eat, your exercise, really ways to reduce inflammation is important for lowering your dementia risk. 2 to 3 sessions basically will give you 24% reduction, 4 to 7 times per week, and for the length, 20 minutes, 30 minutes, and raising your core temperature up a degree or 2 is another metric. But for most, it's 20 to 30 minutes. And for getting started in these protocols where you're let's say 4 times a week, back to the tiny habits or atomic habits, tiny. You don't go into the sauna for 40 minutes for your first session. You just ease into it, ease into everything. That's maybe the general take home from tonight too. Just ease into it, make it a routine, and then build from there. But this is like, if you're able, to me, this is one of the biggest no-brainers there is, like based on the evidence, and it's fairly a passive thing too. So it should have a low threshold or a low barrier to get started. The only thing here, and with the cold, not everybody can buy a sauna. There's local places to go, but that's why I'm working with our local Ontario Health and trying to figure out a way to have some type of community access for these modalities, because again, not everyone can afford to have a sauna, but everyone needs to be able to use one based on these studies. So we're going to try and keep working with them and find some budget, hopefully, to maybe set up a little pilot for that, to have a cold tub and a sauna. And if not, definitely a sauna that people can use, or multiple saunas. And then for the cold, if you're keen, that lake, it's a great spot. You get to mix in the beautiful scenery, combined with the cold benefits. Beautiful. Yeah?
Are steam rooms the same benefits?
They haven't been as well studied. All of these studies a lot of them were from Finland, where it's kind of more of a traditional sauna. You could hypothesize, though, that it really is just elevating your body temperature. So whether it's sauna, steam room, even a hot tub, if you get the temperature up enough, then similar benefits would be expected. Okay, so we can move to perhaps the biggest reason people come to see me in the clinic, and that is trouble sleeping. So we get that referral all the time, and it's amazing if you can help someone or improve their sleep, the downstream effects to what that can do. So it's certainly, there's some things here, and the writing's small, but when we improve sleep, people's pain improve. See that all the time, especially with fibromyalgia patients. When you improve sleep, mood generally improves, anxiety, if people are dealing with that, improves. It's really a great place to start, and in that triangle, or the triad, it's the one I usually try and go after first with folks, because the effects can be so profound. So here's some of the other ones. Mood, mentioned it, pain, fatigue, of course, better healing when we sleep, less cortisol, less stress. Suffice it to say, we need to sleep, and I think everybody here knows that. Who's dealing with trouble sleeping at the moment? Yeah, it's very, very common. And in med school, and even early days of being a physician, you're really taught to don't use really anything, just talk about sleep hygiene, talk about bedtime routines. But the truth is, sometimes you do have to use something. And I'd rather use something natural that works after exhausting, other things. One thing that's a natural thing that helps is just getting sunlight on your eyes in the morning. So many people don't do that and just kind of go about their day, but our bodies are wired, or circadian rhythm, sleep-wake cycles. If you get natural sunlight in the morning and some in the evening when the sun's going down, it's a good way to remind your system of when you're getting up, when you're going to sleep. So we recommend that as well. But honestly, sometimes you do need some help, and that's where we do use cannabinoids. That's kind of, I guess, the main part of my practice now is cannabinoid medicine, and been doing that for years now. And sleep has been the area where they excel. THC, CBN, we'll talk a little bit about pain in cannabinoids, and that might be 40% might respond. But for sleep, it's somewhere around 70% of folks will see improvement. And again, those downstream effects are massive. Years ago, before I was doing this full time, there wasn't a lot of evidence. It was just anecdotal. But now we have randomized control trials to support using CBD and THC in sleep. This one's from Australia. Primary insomnia, they use the primary insomnia index. And this is where, from Western Australia, we saw improved sleep with doses of about 8 to 10 milligrams of THC and CBD. And the next study is a new kid on the block, if you will. So who here is familiar with THC? Okay, heard of it. CBD? How about CBN? Okay, we've got some people that are up to date on things. And this is the interesting thing about my field in cannabinoid medicine. There's over 100 different cannabinoids. We know most about THC and CBD, but CBN, CBG, CBC, not the TV or the radio, but it's remarkable, and we're learning CBN, like CBD, non-sedating, but it has a randomized controlled trial for use in sleep, about 20 milligrams. So there's new research emerging in the area for sleep, and it's a good time to just go over this whole system, because I think still today, it's still not talked about, it's still not really taught in med school, the endocannabinoid system. So show of hands, and it's Thursday night, so we can be honest. Who's got some cannabinoids in their system at the moment? Yes, good. And of course, the folks who raise their hand, they know that we all have cannabinoids in our system. So, yes. So who's got cannabinoids in their system? Yeah. Right on. That was a big aha moment for me, because we didn't get taught this in med school, and this is a real system. It'd be like not learning about the respiratory system or the digestive system. So real quick, we make them. Those are the endocannabinoids. Plants make them. CBD, THC. Those are the phytocannabinoids. Comes from plants, phyto. Endo, for us, endocannabinoids. And then you can make them pharmaceutically. So there are pharmaceutical THC and CBD, if you will, Sativex, Nabilone. One's approved in nausea, one's approved in MS. So, but that's the point of this slide, is really to understand this is a system in us, in plants, in all mammals, vertebrates. So it's been around a long time. Okay. And this slide is to just show you where it is. And it's everywhere. But there's a big density in our nervous system for cannabinoids. So that's where the CB1 receptors are. CB2 is in the immune system, the periphery. So it's widespread, and CB1 nervous system, that's why there's evidence for nerve pain. That's why CBD is effective for epilepsy, a lot of these disorders of the nervous system. And then with CB2, we know these compounds, THC and CBD. THC and CBD is really kind of the major cannabinoids here. And I wanted to go over what people know about these things, because there's some misinformation, there's a lot out there. So what's THC commonly known for? Getting high. All right. Yep, that's the answer we're looking for. Because it's true. That's why it's available recreationally or adult use. It can get people high if they have a lot of it, or even certain amounts. But the point is, it's also a very good antispasmodic. A low dose of THC is good for nausea. There's clear medical evidence. It's an antispasmodic, so it's a muscle relaxer. That's why folks with MS use THC, or that's why there's approved pharmaceuticals that mimic THC and CBD. So THC can get people high, but it's also very used for medically in low doses for sleep. So when I say low dose, we literally start people with 1 milligram. 1 milligram of THC is different than smoking a joint and consuming hundreds of milligrams. So impairment with THC, not CBD, is really dependent on how much you take. So I just wanted to make that point because I think it's important. CBD, non-impairing, you can take it, drive. That's been studied, well documented. But CBD has medical utility too. That's what we give kids that have 100 seizures a day, which is crazy that is a disorder that exists, but it's true. And these kids, don't develop well because they're having so many seizures. CBD, after they fail, let's say, 1 or 2 anti-epileptic drugs, they move to CBD, and for some of these kids, it's curative, and it's remarkable. And that is medically, there's a ton of medical literature, that's why it's recommended, and a lot of people don't know that about CBD, that it has like that powerful anti-epileptic effect. Also, it's anti-inflammatory, and we are also learning, and this has gained traction, that I'd been seeing this over the years. People were taking CBD and telling me it was good, helpful for their anxiety, but there wasn't a lot of medical evidence. And in the past couple of years, there's been a couple different randomized controlled trials that do indeed show CBD can be helpful for anxiety. So we have folks that use CBD during the day because it doesn't cause impairment, it can help manage anxiety, or it's an anxiolytic. So that's just a little bit about the 2 different cannabinoids that we see and that are most studied. Any questions about any of that? THC, CBD? Yeah. So it's an interesting question. THC certainly can be. Where you see that though is the folks that are smoking high amounts of it. There's a lot of stuff out there that's like very potent THC and people smoking multiple grams of cannabis a day. That's when you see the issues. CBD is there's no dependence with CBD, so it's quite different. And THC in the medical setting, someone's using it for sleep or MS or nausea, vomiting. You don't see folks becoming addicted to THC when they're using low doses. So it's kind of a yes, but it's a little nuanced too. But that is an issue, is cannabis use disorder. So I'm here talking about the benefits in a controlled fashion for folks that have specific diagnoses where there's evidence, but there's certainly an issue out there too that we get referrals for folks who are using too much cannabis. Late teens, early adults seem to be kind of the window there where we see that, and that's much different than using it medically. That's using it all day, smoking it just to smoke it, no rhyme or reason. And I heard it put this way too, like it's a crutch, of course, like they're using it for everything, versus on the medical side, it's more of a tonic. There's a reason, there's a purpose. So cannabis use disorder is certainly a real thing and something that we try to educate patients on and actually get referrals to help people come off cannabis as well. This is a quick little review of a study that we did here locally. So it was just published in a peer-reviewed journal about 6 months ago, even though it was about 3 years ago when we collected the data. But I wanted to share it with you, to show you the results, but it's kind of a general theme that you'll see with other studies, and another thing about medical cannabis, and then we'll move to some other topics. So this one I was one of the investigators on, and wanted to show you, and it links back to the start of the talk, the triad. So in our research, it really reflected that. You can see the symptoms: chronic pain, insomnia, anxiety. Those were the top 3 with all of our patients, and this data set was a few hundred patients. And you can see on the bottom there, pain, insomnia, mental health issues. So that reflected what I was seeing clinically, what I was talking with other doctors all over Ontario about. And on the next slide, you can see why I enjoy this practice. It's one of the tools. Cannabinoids are one of the tools. I'm certainly using more tools these days, cold, hot, meditation, but this really still is a core of my practice. And you see it here, like pain improvement scores, right? The sleep improved for a lot of these folks Quality of life. That's a stat that we always include in the research we're doing because it's one thing to have pain scores, rate your pain 9, now it's a 5. Okay, it came down, but like, what does it mean? So these quality of life measures are great to really get a sense for how people are doing, and to me, they highlight the benefits of medical cannabis. So 74% improvement in quality of life. The next thing, or the bottom two there, 63% decline in the ratio of like the patients on opioids. So we see that all the time. Folks will come on to cannabinoids and be able to wean off opioids or at least lower their dose, which is a win, less constipation, less risk for addiction. Problem is, we have a lot of folks on ODSP or disability who would like to use CBD or THC, but have to use hydromorphone or Percocet because that's what our drug benefit plan covers. So the powers that be are happy to cover more addictive, more harmful medications, but not yet CBD and THC, which is a shame because these folks on disability have to choose between groceries or buying their medication. So they inevitably go back to the opioids. Then they're on a stool softener because now they're constipated, and it's a hot mess. So hopefully, with more, I don't know what it's gonna take. I'm really hopeful this research will help because I'd love to tell you it's gonna be based on results and patient satisfaction and efficacy. But in our study, we saw a 55% decline in prescription drug costs. So that, I think, will get our governing bodies to pay attention to that. Not only are the outcomes better, but prescription drugs are reduced, meaning less spend for the government. And I think that will get their attention, or the attention of the insurance companies too, that not only is it helping, but you're lowering other prescription drugs. All right. So the next, yeah.
I just wondered if you were aware of any advocacy measures in which the public might be involved in having a voice.
There's a few groups. There's the Medical Cannabis Council of Canada that does a lot of lobbying and advocating in Ottawa. Locally, I always tell people to write Marilyn Gladu, Bob Bailey, just keep flooding their social media or their email. And there's another group their group's something about the excise tax, because not only are the medications usually not covered, they're taxed. That's the only class of medication that there's an excise tax, because they're treating the medication like a recreational product. So something about axe the tax, or I think that's actually something else, but something about excise tax is a group as well. But that would be a dream of mine. There is insurance company, health spendings accounts, but really the dream would be, for God's sakes, cover it for our 85-year-old lady who is using it to sleep, for the person in long-term care who has dementia, and we've weaned them off their antipsychotics. Of course, they're covered. So there's a number of examples. Even the kids with epilepsy, this is the saddest part. These kids, parents' families have to buy the only medication that stops their seizures because it's not covered. So luckily the LPs like Avican, Tilray, Spectrum, some of these names, they'll cover 90% of the CBD oil, but the family still has to spend, which is crazy. Yeah.
Isn't it a big fight against the pharmaceuticals as well?
Yeah. They, a lot of people don't know this, but Health Canada is funded basically by pharmaceutical companies, so they have a real hold on things, and they do not. These natural therapies are really a thorn in their side, basically, because like there's not a lot of money in cures like obesity. There's Ozempic or exercise and nutrition, and right, or for depression. There's the SSRI class, take it every day, some for the rest of your life. Or again, there's other things you can do to improve mood: cold plunge, sauna, sleep, exercise, nutrition. But yeah, they've got a hold of the thing. There's a lot of chronic diseases that are good business too. Obesity, diabetes. A lot of the medicine 3.0, though, is all about stopping before you get there. Like, not come and see me, we just diagnosed you with diabetes. It's like, let's see me before. Let's prevent the diagnosis. So pharma's, yeah, they're an issue for that, especially with psychedelics, and we'll talk about it, but that's another area where there's clear evidence, emerging evidence, something like psilocybin for long-term depression or refractory depression can be helpful, and it can, and I've seen it. It's remarkable. But in some cases, it's curative. Like they have a session, they do all the counseling, person's mood improved, maybe for a year, maybe for 2 years, but they're really weary of that class too of the psychedelics, because now folks won't be on an antidepressant for years. So it's a battle. I'm certainly not anti-pharma. Being a physician, we have certainly many needs for certain things, but a lot of these chronic illnesses, I think we can rethink them and be more preventative than reactive. Okay, the next kind of theme, if you will, just piggybacks on that study, the triad. I just had a quick review here for everyone to show you. It wasn't just our study that showed pain improving, mental health, and sleep. This was published in JAMA, which is one of the most well-respected medical journals. But look at this common trends again: chronic pain, insomnia, and anxiety for medical cannabis improvement. And if we go to the next slide, it's the same thing. This was in the Journal of Substance Use, and it included it again. They did a big review, 27 studies. And what did they find? Same thing. Substituting medications for medical cannabis, opioids primarily, but chronic pain, mental health are the leading reasons for medical cannabis in this review. Quick note, doesn't work for everybody per se, nor does any medication, but this is to show you that it is coming up in large numbers, that it's helpful for pain, anxiety, insomnia. So's exercise, so's sleep, so's having a good social network. So a lot of these chronic things of the triad, they are best managed not with one thing, but really optimizing multiple different things. Okay. I threw this in because it was nice to be in the room where it happened, if you will. New recommendations, common sense recommendations. For years, there was nobody making a statement like this, but at McMaster and the Michael DeGroot Center for Medical Cannabis Research, this was the first kind of big recommendation to go out to physicians and pharmacists that basically, if standard of care without opioids or cannabis, so folks have chronic pain, they haven't tried medical cannabis or opioids, the first time someone's put this out there, they recommend cannabis over opioids, which is a great step forward. We need the coverage to match it, because with this recommendation, one's covered, one's not. But this is something I've been, letting other physicians know in my talk, and something I'm really glad to see. Happy I was a part of it, but and it's pretty common sense, One medication, cardiorespiratory depression, you can overdose, you can die. We see it happening all the time. And the other option is well tolerated, no cardiorespiratory depression, no lethal dose, less risk of addiction. So common sense, but happy to see. This talk too it works for everything, but it certainly should be considered and available to you if that's kind of the way you want to go, or you and your physician want to go. Last thing on this, to wrap up pain and sleep and anxiety, a diagnosis like fibromyalgia, usually all three are in there: trouble sleeping, pain, anxiety. And I only put this in to just show you, if you're new to medical cannabis, just what we're using. So nobody's smoking anything. We're using capsules, drops, oils, things you take by mouth with specific doses. So this is just a case of a fibromyalgia patient, and on the next slide it'll show you what we used. And so we used a CBD oil for the daytime. So she takes, I believe, 0.5, 0.6 twice a day, because it lasts for 6, 7 hours. So most people will have a dose in the morning, a dose in the afternoon, and then it's very common in fibromyalgia or a lot of pain conditions to not be able to sleep as well. So that's when we use something like a balanced oil. It has equal parts THC and CBD. This patient was on 0.6, so they're getting about 6 milligrams of THC, 6 milligrams of CBD. So just put that in there to show kind of a very common treatment is CBD for the day and usually some THC and CBD at night. You can see there her scores improved and were better at the 1 month follow-up. And then again, we're gonna talk about one other thing. I guess kind of the point of this is to let you know it's usually one product or two or formulation. But there's also another one that when I gave this talk a few years ago, it wasn't even really a thing. And now I'm seeing a lot of benefit with the topicals. So topical THC and CBD. And so you might be wondering, what would I use a topical for? And any kind of irritation or dermatitis can be helpful. A lot of pain conditions. So we have a lot of folks with arthritis, and you rub it on your knee or your hands. Generally the superficial joints. So something deep like a hip, a topical is probably not a great option. But for the hands, the knees, the feet, peripheral neuropathy or neuropathy from diabetes, diabetic neuropathy, affecting the hands and the feet, rubbing the topical creams can be helpful. So I wanted to let you know that as well. If you're dealing with any of that, this is a pretty nice option. It's really nice because even today, folks, there may still be some folks here who hear cannabis and think, I'm not even going near it, even though CBD doesn't cause any impairment. Topicals, great way to dip your toe in the water. You can apply it to the skin, there's no impairment. So I often, when I'm teaching other physicians, I'll get them started with using topicals. They're more comfortable with that, and then we move on to other things. Let me think about a case. Varicose veins. That's one where you might think, wow, what? Topical for that? So people who have varicose veins, they get itchy, really, really itchy. And these topicals, for the vast majority of folks I've seen, have been really helpful. So from an anti-itch point of view, quite nice. All right, we'll move on from the land of cannabis and get back to,
One quick question. I have a friend who's got excellent topicals that have come from British Columbia. Do we have a source locally that we can find topicals?
You can find them in the stores. The thing is, it's a matter of what's in them. Like at the stores, like what kind of base. They're all tested, and they're all, like if you go to a local store, it's from a licensed producer. But yeah, you might not know what's exactly in the base. So that's why, is the one from BC more of a craft?
It doesn't seem to be. She has both a solid stick that looks like a deodorant.
Yep.
And then also like a roll-on actually.
Yeah.
So it's an oil, and the ingredients are listed very clearly in the carrier, as well as the levels that are within it. And I have arthritis on my hands. I can tell you they are magical.
Good. Yes. and you can see, yeah, the carrier, and that would be my advice to everyone. If you go to buy one on your own, you know, make sure you know what carrier's in there and you don't react to it. That's great. They're wonderful. On that note too, so you know, on the medical side, now these companies are formulating like real pharmaceutical grade, if you will, products. And that matters in the land of topicals because there's certain things you need to put into a topical to have it penetrate the skin. Yeah, so now there's being investment in products, investment in research. So there's a new CBG gel on the market with some pharma tech that's really nice too. So that's just FYI for folks, yeah.
If you're on a medical program with cannabis, what are the chances of being addicted?
Can you repeat that?
If you're on a medical cannabis program,
Yeah.
what are the chances of getting addicted?
Slim, very slim. When you're on a medical program, yeah. There is addiction with the recreational users, certainly. Yep, but when you're taking these doses, you know, 5 milligrams of THC for sleep or something like that, I've never seen it. And there's a difference too between addiction and just taking the medication to treat your condition. So for instance, with sleep, folks aren't addicted. They have a sleep disorder, they're taking 5 milligrams, they're sleeping. When they stop, they go back to how they were sleeping before. So they stay on it, not for addiction, but because it's helping the root cause there. But certainly cannabis use disorder in the rec setting, teens, younger adults is an issue. Yeah. Yeah.
Reading something about how it affects the liver enzymes.
Yeah. So that's a deep dive. Nice work. That's a thing where, because of the research, the epilepsy research, when they did these studies, they saw CBD can elevate liver enzymes. And, you know, we are mindful of that. So if someone does have elevated liver enzymes, we want to know about it, we monitor it. But taking it a step further, it's not in the doses that we use. So when these kiddos are treating 2 and 3-year-olds, they may need 1,000 milligrams of CBD, 1,000. The folks, adults with anxiety, might take 20 milligrams, maybe max 60 in a day. So it's the amount, there's two things. It's the amount of CBD. So let's say for our discussion, nowhere near, 1,000 milligrams. But the confounding thing from that data, in these studies, you saw CBD increase liver enzymes in kids with epilepsy, but they're also on 3 anti-epileptic medications, which are known to increase liver enzymes. So they couldn't tease out, is it the CBD or is it, they're on all these anti-epileptic drugs? So that's why they're elevated in those studies too. All right. Moving on from cannabis, unless there's any more questions. Yes.
Does cannabis treat petit mal and grand mal?
So it's been studied in Dravet's syndrome, so these like rare genetic seizure disorders, mainly in the pediatric population. So there hasn't been a whole lot of research on adult seizure disorders. Anecdotally, there are some adults taking CBD and finding it helpful, but the truth is when it comes to those seizure disorders, there aren't too many docs or neurologists that are using it in adults just yet. That will change with more research. And the other sad thing is I do fully suspect it will help petit mal and grand mal seizures. If kids, the dose is, let's say, 1,000 milligrams because it's based on weight, an adult with a seizure disorder would need, much more than that. And it would be so expensive that no one could. So until there's coverage, you won't see it except for in like research settings. Yeah. Yeah.
Is there any reliable non-medical CBD oil
Yeah.
in the market?
Yep. If you go into a store, like not, let's say on the res or something like that, but into a store and you get a tested product, like anything that's in the stores, they're tested. And so, yeah, there's reputable CBD in the marketplace that's not in the medical framework. The only thing you gotta watch is just the supply can go in and out. So they might have it, they might not. And a lot of these stores are geared towards rec cannabis. So there's a lot of higher THC products. But having said that, to answer the question, yep, some of the stores carry it too. And soon, to follow up to that, there was a big release by the government. They did a big expert panel review of the Cannabis Act. Few recommendations for medical, and glaring was, we need more physicians and nurse practitioners comfortable with the topic. That was one of the recommendations. We need to educate all the docs on the topic was another recommendation. Another recommendation was, the reason they said that was because a lot of practitioners still will just say, I don't talk about it, just go to the store and talk to them about your cannabis. And the government identified, and of course, it's common sense, like that's not good medicine to be sending, let's take an extreme case, a kid with a seizure disorder to the bud tender, or yeah, that's what they're called too, the old bud tenders. Or in my world, in dementia and long-term care, a caregiver or a POA, the doc tells that family, just go down the street and talk to that guy at the shop and then give it to your loved one who's in long-term care. So there's it's a total malpractice scenario what's going on with having practitioners sending to stores. So, so to finish that train of thought, the other recommendation was things like CBD should be in the pharmacy as well, OTC, or over the counter. So that just makes sense. That way you don't have to go into, let's say, a dispensary, which has a different vibe. You can go to the pharmacy, get your CBD like any other, like a Tylenol or an Advil or anything like that. Yeah.
Is there a shelf life for this?
Not so much. It's just over time, they degrade. And when they degrade, less active. So it's not as if they'd go bad per se, but they might not be as effective. So I always tell people if it's after a year, then get rid of it. Yeah.
What dose do you recommend for sleep? Or combo?
Yeah. So it's individualized for sure. And we always start low. So you start at 1 or 2 milligrams. In my experience, most people between 5, high-end 20 milligrams of THC. But the issue with going up with THC, if you take too much, it can residual effect in the morning, a little tired, a little draggy. So there is a sweet spot. And for most, that's between 5 and 15 milligrams. And as far as the concentration, because of that research on CBN, so now there's products with THC and CBN, and that's what I often use. Yeah. Yeah.
Is the quality as good as the medical grade
For?
of the oils or the capsules in the store?
Yeah. As far as quality goes, yes. But we're getting into a land where the medical side is the research is moving forward as far as R&D and spending on things like the topicals for special formulated products for advanced absorption. Or on the medical side, there's now nanotechnology, like making the knock on the oils in the capsules, because cannabinoids are fat-loving or lipophilic. They take a while to take effect, an hour or two. So now there's products being developed to speed up the time. So there's products on the medical side making it water soluble, so active in like 10 minutes. So there's a number of reasons for the medical side, but if you do go to a local store, you can be certain it's at least the amount of THC and CBD in there are, like, it's tested, it's a quality product. Yeah.
I guess my concern would be, if you have chronic pain, insomnia, whatever, and I walk into a store, I would have no clue what to look for in terms of dosage or anything. So
yeah.
that, I would think it would be better to seek medical attention.
Yep.
To at least get started.
Oh, for sure. And not just that, like, for those reasons, yes. But it's you're managing a real medical condition, then definitely you'd want to talk to your physician about it, or get a referral, come see me. But for that reason alone, if you're managing something medically or it's a medical diagnosis, definitely. And on the dosing, to your point, that's why you want to work with someone too. You want to be guided. You don't want to be given something that's high THC when you're looking for CBD, or there's a lot of reasons. It's common sense, but if it's a medical issue, yes, talk to your medical provider. And even people do this, but they're not allowed, or shouldn't. They're not really. You go into the store, the budtender's not supposed to give medical advice. And sometimes they do, and there's some knowledgeable folks. I don't even want to throw any shade at those folks, but the truth is, they're not, per the Cannabis Act, they're not even allowed to give medical advice. So, long-winded way of saying, if it's a medical condition, talk to a medical professional. Yeah.
We talked about CBN. Is it a plant like CBD and THC?
It's in cannabis, so all the picture of the plant, depending on the strain, it'll have varying levels of THC, CBD, CBN. Some strains have higher THC, some have low. So it's actually in there. Yep. In varying levels.
So when you look at the different strains, it'll tell you what level CBD or THC.
Yeah, you'll see like a THC percentage of,
And then those do that with CBN.
Yeah, but they're really not. It's not really in the dried bud. You won't really find much flower with CBN. You'll see it in like a finished product, like an oil or a capsule. Okay, now we'll switch gears. We'll try and get active here. Talk about exercise, because if I could make a pill that had all the benefits of exercise, I would be loaded. Because it really is the mic drop, the showstopper. If you want to age well, live well, be well, you have to exercise. You got to move your body. This is the key. So I've listed some things up here about the different benefits, and as it relates to a number of things, but just I know for myself, from a mood standpoint, from a sleep standpoint, I need that in my life. And you don't have to go to a gym. You don't have to do it for hours a day. You just need to make it a priority. And if you're not doing it at all, you just need to start with a minute or two a day and make it a routine. Because as we age, we lose muscle mass. And that's it's going to happen. It's going to happen to all of us. So the idea of, if we're talking active aging tonight, why you would want that, why you want to exercise, why you want to use weighted exercise, is you want to build up your strength so that when you lose, you're losing from here as opposed to here and down here. If you're up here, you lose over time, but you're still higher, right? So it's so key for that muscle loss. Not big weights, but some weighted exercises. Why else is it good? In addition to, the muscle loss, or preventing muscle loss, or losing it slower, losing from a higher ceiling, bone. As we age, bones get a little weaker. I'm sure there's some folks with osteoporosis or osteopenia, and exercise is one of the best medicines for prevention of that. So I can't say enough about these benefits. Let's toss another one in, dementia risk. So if that wasn't enough, it's clear, all for the same reasons too about sauna. We talked about with like improved cardiovascular fitness. Exercise improves your cardiovascular system, reduces dementia risk. So aerobic exercise, 30% lower risk of cognitive decline. In this other study, 35% reduced risk of developing dementia. And here's our friend again, the same friend from the cold plunge section, BDNF, brain-derived neurotrophic factor, or the Miracle Grow for the brain. Exercise also increases that. So there's just so many reasons why we all need to consider this. If it doesn't come naturally, don't sweat it. Like, just try different things. And really, again, small. Like, everything can be manageable if you just break it into bite-sized pieces. So it sounds crazy to walk for 1 minute, but honestly, setting the routine is the most important thing. Doing that walk the same time every day. 1 minute. And then after 2 weeks, okay, maybe you go to 5 minutes. But if you can establish a routine, you can stick with something. There's hacks to stick with it. There's a thing called anchoring. So you could think of it this way. After I have my coffee, I will go for my walk. Or after I brush my teeth, I will put my shoes on. Something you do every day is a great thing to anchor your new habit to. So it's just a way to hack the system, because you want to reduce the friction as much as you can, and that's the key. Have the shoes out. Coffee's done, shoes go on, out the door. Make it easy for you to succeed. Okay. This is great. I love this study. Also another ChatGPT image. Yeah, I think I put in, please, like an image of some older folks playing racket sports, and there we go. But anyways, this study is awesome because it's a good study, it's a big study. But people who play racket sports live longer. So how many pickleballers or tennis folks do we have? Nice. Very nice. Good. And if you haven't, give it a go. A, pickleball's fun. And B, you live longer. So look at that, 47% lower risk of all-cause mortality. So we put in 2 mic drop moments for all-cause mortality, or lowering your risk of death. Sauna was in the 40s, racket sports. So this is the sauna, you just sit there. This is a little more active, but you get the benefits of the activity. Any of the pickleballers know the social community, the chatting, the bonding. As we age, that's super important too, to still have those connections. So another thing with multiple reasons to consider adopting. All right. It's funny, each one I'm like, yeah, this is important too. But this is another one. This one's a little trickier though, I'll be honest. Even though cold plunge sounds hard and maybe a little scary, it's easy. You just get in, work's done. Same with the sauna. You just sit there. Meditation is tricky. Only in a great way too. But in a great way it's tricky because it is also not hard. You just sit there, right? But it is so hard for people to try. I talk to people about it. Some people just are so in their head, they're like, can't do it, don't want to try it, or I can't try it, I know I'll suck at it. And they're done before they even start. But this is another example of a really important thing you could put into your life, or an important modality that can really have profound benefits. One thing, again, start small. If you're in the camp of like, already you're getting a little anxious just thinking about meditation and sitting there quietly by yourself, don't sweat it. Just start with a minute. You can do that. But that's really the message on the starting and taking it slow. I would also recommend doing it outside, because as you'll see or develop your practice, it's not turning your brain off and shutting the thoughts down. It's just opening up to everything. A sound, the wind, and you're just taking a break from being lost in thought. And, our egos exist because we create them. So it's like, it's taking even a break from your own ego. You're just, even the ego thought, let it go. Sound, this, that. And eventually, it becomes pretty nice when you can sit there. And it'll be frustrating for the first little bit, but you even observe that. That's a good thing to note. You'll be frustrated, and the point of meditation is to even watch that. There's me frustrated, and then back to meditating. So some of that might sound a little weird or kind of high level, but that is the art, is just letting everything kind of go, watching thoughts, sounds, and seeing what your internal operating system is. Almost like if you hear a computer and there's a background humming or buzzing, we have some operating system that just is on. We're so lost in thought that you can't hear it. So that's what's good about meditation. You're not lost in thought anymore. And I'm going to list a number of benefits. Yeah.
I understand what you're saying with meditation, but it's also the same thing with prayer.
Yeah.
Find yourself, like, just take your moment with the Lord, you also get the exact same.
Yeah. There's synonyms. Prayer, meditation, affirmations. They're all kind of scratching at the same thing, if you will.
Not really.
Agree to disagree on that. Agree to disagree, because I've heard many of people within a number of church communities say the same thing. So I think they're in the same ballpark, if you will. We'll put it that way. But when you talk about, I mentioned like the realizing you're not your thoughts, realizing you have this operating system and just kind of giving way to it. That's a big benefit, and it has these effects. I'm going to list them, and then I'm also going to kind of contradict myself a little bit. But this does matter. Meditation is good for stress, anxiety, emotional health, physical health. There's new evidence to even suggest it might reduce cognitive decline or dementia. Improves focus, certainly, memory, concentration. So, a number of benefits, but I would argue that that's even like, it's scratching the surface of like, the real benefit is so profound you almost can't list the real benefits. It's kind of that deep. Similar to if you said, or if I said reading can relax you, right? Reading can improve your mood, perhaps. But to articulate how reading can open doors, you can communicate, how you learn, how you can go on to do this career because you learn how to read, the same thing is true for meditation. Like, it is a door opener to a lot of different things that, can't even be listed here. So for all these reasons and for that deeper reason, consider giving it a go. Yes.
I was just going to say, it is not easy to meditate, but there's so much help, either through YouTube or different apps. That,
Yes.
if you find one that applies to you, if you do a bit of research, it's very helpful.
Yeah.
And reduces the level of frustration tremendously.
Yes. Well said. The apps, the YouTube meditations, wonderful. Any way you can get started that's easy for you, great. I personally like this Waking Up app with Sam Harris, who's a neuroscientist, and he put together this program, and that's what I like about it. It's like a course. So the first 30 days, there's meditations of, a small length, but there's also some corresponding theory of why, how it's working. So you kind of meditate, but also learn 5 minutes at a time. It's a good way if you're new, like it's an introductory 30 days. So it gives you a little theory in addition to the meditation, which is helpful. So that is the Waking Up app. There's the Calm app. There's 10% Happier. There's a bunch of apps. A lot of stuff on YouTube. Peloton has meditations in their platform. So another way of just saying, however you do it, just start. Use whatever app you like. Start small, and if you stick with it, you'll be glad you did. Another hot topic: psychedelics. Who has heard any news about psychedelics being helpful for any medical condition? Yep. Okay. Who knows what psychedelics are? Who's heard of them? Yeah. All right. So they are psilocybin or magic mushrooms, ketamine is a pharmaceutical one, MDMA, which street drug is ecstasy, but the pure form is MDMA and used medically with counseling. I put this in here. We could have a whole other talk about this, and maybe we will someday. Same thing about some of the other topics. They could almost be their own topic because they do require a bit of a deep dive. But I wanted to include this because this is an emerging field of medicine that has medical evidence that is showing remarkable results for certain conditions. And not that anybody here needs to go try anything. I just wanted to educate you on it. Maybe you know someone that could benefit. But I wanted to go just through the high level of the diagnoses. So psilocybin or magic mushrooms, we're learning with evidence from Johns Hopkins University, NYU Langone, like Columbia, so big schools. This is not like hocus pocus medicine. It's really well studied. Psilocybin with therapy, that's the other part to these. Very beneficial for refractory depression. So again, those folks who are depressed for years and years, and end-of-life distress, getting anxious with end of life, making these people more comfortable, more calm, more accepting of the process, really can be valuable. So that's with psilocybin, and you take a big dose of it. You don't take a micro dose. You might have heard of that. But you take a psychedelic dose in an office with therapists, people are there, it's safe, but you do a lot of therapy as well. So it's not just, here's a psychedelic drug, enjoy. That also can be fun. And no. The other one is MDMA, ecstasy. This is another one that is remarkable as far as, we haven't had any new medications for PTSD in 50 years or so. And the best ones on the market now are 30% effective, somewhere in the 30s. The MDMA trials, which have been going on for 20 or 30 years, real research for 20, 30 years show somewhere in the improvements of 60 to 65% for the folks who do the treatment and the therapy. And it's a lot of PTSD, so a lot of combat veterans, and it puts them into a state where they can do therapy, where they can go to those memories because of the MDMA and be, I don't know, they can feel safe, or like almost like a pharmacologic hug where they can then open up, talk about it, and finally get through it. So we mentioned Big Pharma may not like this because these folks are sometimes cured, sometimes it's the only study I've ever seen where people get better in year 2. So it's like 60%, then to like 70. So they get better, or even more better, a year or 2 after. So putting it on the radar, because it's exciting for medicine to see new therapeutics that are helping and new ways of thinking about things. But like anything, there's resistance to change. So it still hasn't gone through FDA phase 3, but that is going to happen, and these will be available. Right now in Canada, I can write a special authorization for people. It's a ton of paperwork, and of course, they don't make it easy, especially for terminally ill folks who want psilocybin therapy. Sometimes the paperwork can take a month or 2, and that person has passed. So we need Health Canada to make this more accessible for folks who need it with these conditions. Again, it's evidence-based, but the system right now is very slow here in Canada. Happy it exists, happy we have a special pathway, but it needs to be improved. And lastly, ketamine is probably the easiest as far as accessing locally. There's a number of folks who do ketamine-guided therapy, the different counselors in town. Of course, you need a doctor to prescribe it, but that's an area where depression, mainly treatment-resistant depression for ketamine, which is used in the OR often, but it's now being used to treat depression or refractory depression, and that's an example of a pharmaceutical psychedelic. All right. Lastly, even though this was the natural therapeutics talk, I would be remiss if I didn't talk about AI. We already talked a little bit about ChatGPT. That's an example of AI. But AI in medicine is going to be massive and positive. AI is going to really improve things if done correctly and adopted widespread. And there's a number of things that need to happen, but if it does, it has the opportunity to really change medicine. And so I thought, we could chat about AI in medicine and why it might be beneficial or how. So number one, accuracy and safety. So right now, medical records here still in Canada, even though we have a covered healthcare, public healthcare, there's still a lot of systems that don't talk, and this hospital doesn't talk to that hospital. And AI presents an opportunity to get everything on the same page, updated in real time. You could be at this hospital, and they know exactly when your last scan was, or labs. And with the cloud and AI technology, medical errors will go down. That's still, believe it or not, medical errors are still a thing, misdiagnoses, things like this. So AI represents a great opportunity to improve those. It also, as far as like diagnostics, AI has in diagnostic accuracy. There's already some AI technology in medicine in fields of radiology, for instance, that are reading X-rays, CTs better than seasoned radiologists or pathologists. So there will be a world where AI is assisting the physicians in reading these tests and even coming up with diagnoses. Sometimes there can be confirmation bias in medicine. A certain physician or healthcare practitioner sees something regularly, and they might kind of get locked into that. With AI, it represents an opportunity to have almost like an unbiased buddy by your side who has tons of medical knowledge that the physician can plug into, reference, and they can work as a team. So there's going to be improved diagnostic accuracy with AI. Why physicians, I think, will adopt it is there's opportunity to spend more time with the patients, because there's technology like AI scribes. Over the last few years, myself, Alvin, we've been documenting in the EMRs, charting, and I'm sure you guys have seen it. Your doctor's here, but you're here, right? And so these AI scribes give an opportunity to record the visit, do all the documentation that really isn't. We'd rather talk and figure out the plan and relate and build rapport than just be typing away and filling out boxes for our notes. So AI is going to really present an opportunity for better doctor-patient relationship, where the doctor can spend more time looking at you, talking with you, as opposed to just typing in the computer. So looking forward to that. And I know there's probably some folks who hear AI and think, this is scary stuff and risky stuff. And certainly, in different fields, there are certain things to consider with AI. But in medicine, I think it's a slam dunk that it's going to progress the field. You're going to have access to research, will be so much easier to do. And relating it to everyone here, I think the biggest area for you guys would be all the wearable technology. So there's a big difference between going to the doctor's office, taking a blood pressure, maybe you have a little bit of white coat hypertension, it's up, that's the one reading. With these wearable technologies, you'll be able to have continuous blood pressure monitoring with AI interpreting it. If there does need to be an alert, it'll send it to the doctor's office, or some diabetes, continuous glucose monitoring hooked up to AI. Really presents an opportunity to have very accurate readings of your heart rate, your blood pressure, your glucose, as opposed to just a point in time at the office or one lab draw. So this wearable technology with AI integration is going to be very important for chronic disease management and a very positive thing for medicine in the future. But it's early days, so stay tuned. Okay, and last but not least, we're talking all about actively living well, right? Thriving in life. And a lot of ways to do it for you, for you to do for yourselves. But since we're here in this lovely environment, I think this is one of the best messages and a real reason for thriving and caring about your health, is so that you can serve others. And to me, that's the ultimate way of living and thriving and doing all this stuff to stay healthy so that you can help others. And from Proverbs, a generous person will prosper. When you refresh others, you will be refreshed. And it's true. And I know probably everyone here has had that moment where they felt so good helping someone else. And I think that's what it's all about. So I'll leave you with that. Thank you.